heart attack, first you need to identify the signs such as chest pain, which maybe radiates to the arm and neck. Then you have to call the emergency and ensure that the patient is in the sitting position. Then comes the choking. Get behind the person, give 5 backflows between his shoulder blades, and give 5 quick upwards and inward abdominal thrusts by holding your hands between his lower rib cage. Then comes the patient with burn. Cool the burn under cold water for at least 15 minutes. Then loosely cover the burn with a cling film or a clean plastic bag. Then comes the heavy bleeding. Elevate the wound area above the heart, put pressure on the wound and see if there is any foreign object in the wound, then apply pressure around it. Then comes the patient with fracture. Stop any bleeding. Don't try to realign the bone. Immobilize the injured area. Apply a splint to the area above and below the fracture site. This can help reduce discomfort. Apply ice packs to limit swelling and help relieve pain. Next is the patient with seizure or epilepsy. Do not restrain the person but use a blanket or clothing to protect his head from injury. After that, help the person rest on his side with his head tilted back. Do not put anything in his mouth. Next is the patient with sprain. First of all, rest is advised. Support the injured part in a comfortable position. Then use ice every 3 hours to reduce pain and swelling. Then comes compression bandage to wrap the injured area, and at the last but not the least, elevation is advised. At last, it's the patient with stroke. There are 4 identification points. First is the face drooping, then the arm weakness, third speech difficulty, and D for time to call emergency.